And so what our cats deal with, and dogs sometimes too, is they don't produce enough insulin or their pancreas becomes insulin resistant. And when that happens, they have all this sugar circulating in their bloodstream, but they just can't use it. And so historically, what we've done to treat it is we've used insulin injections, just like you do if you're a human with diabetes. But there's a lot of issues that come with injections with cats and dogs. They're not always willing participants in their treatment. And so what I wanted to talk about today is some of the new alternatives out there. Now, these are only available for cats. So that's really important to know. This is not appropriate for your dog. But for many newly diagnosed cats, these drugs are changing the game. So as far as I know, they come in kind of two forms. There's one that's a tablet and one that is a liquid. I tend to prefer the liquid for cats because I think most clients do, but that's a whole nother conversation. And the other nice thing is they're only administered once a day.
Very nice.
Far easier than twice daily insulin injections. And honestly, the monitoring and regulation that has to occur with insulin is far less with these oral products.
Nice.
Now, there is quite a bit of monitoring that's required in the beginning. And that's the big problem with these drugs is they're not for every single cat. And so when we first start them, we do have to check some blood work values, usually the first 2 to 3 days after we start it. Then a week later, and then a lot of times we'll do a couple weeks, month later after that. And if everything's going well at that point, really the monitoring becomes very minimal as long as your cat is staying healthy. So it's really just changing how we are able to treat these guys. And there's a lot of clients out there who previously would not have been comfortable with insulin injections, but are comfortable giving these medications.
That could be life-saving. I know we have cats brought into the Humane Society, and sometimes it's
Surrendered.
simply just, the doing the injections and the monitoring and everything is just too much for people. It's too stressed, it's stressful.
It's stressful too.
It's scary
yeah.
for them to give injections to the cat. And
if you
so
go out of town, you have to have someone else do it for you. And if you mess up your insulin injection, you can cause a lot of bad problems with these oral medications. Once the original risk is overcome and we know they're going to tolerate the drug well, there's really very little risk after that. They do really, really well.
Wow. Wow. And also too, with diabetes in cats, I guess it's good to remind people if you get a cat that is diagnosed with diabetes, that doesn't mean it's going to be forever.
Not always.
Like
no.
with humans, it's usually forever, I guess.
Yes.